Jazzcast Pros.
Welcome to Healthy Illness. So, what is health and why do we get sick? In this episode, we're going to discuss what makes up a person's health and the risk factors of disease. Some of the highlights that we'll go over are risk factors, health outcomes, and why those health outcomes negatively or overly impact Black and Brown residents of Erie and Monroe counties. By the end of the podcast, you will be able to identify the social determinants of health and understand how those social determinants of health have an impact on your health. Welcome to the Healthy Illness Podcast. This is a special edition, and we are talking about your health, your whole health, your mental health, your physical health, and what are some of the external factors that can affect your health that may perhaps make you a high risk person for certain health outcomes, and also ways in which you can make changes in your life to combat those very things that you may or may not even have control over. So let's talk about it. Physical health and mental health. We all have a measure of physical health. We all have a measure of mental health. You can be physically healthy or mentally healthy, right? And you can be physically unwell or mentally unwell. You can also have an acute illness or a chronic illness. So, an acute illness or acute disease, an acute health condition is going to be something that has a quick onset and you don't have for a long period of time. So, the common cold, right? The coronavirus would be an acute for many people. Now, we do know that some folks have long COVID and they're working to figure out what that is and why it works. But most folks, if they contracted a virus like a cold or like the flu or like COVID, it would be considered acute. It is fast to occur and also, for the most part, fast to leave your system. Whereas a chronic condition or a chronic illness is a long term condition that you live with really for the rest of your life. The onset is not quick. It generally takes a while to get to the place of having that chronic disease. And once you have it, it's something you live with. An example of a chronic disease would be diabetes or high blood pressure, arthritis. These are long term conditions that once you have them for the rest of your life. But here's the thing, both chronic and acute illnesses are more prevalent in people that identify as Black. And that is because of what public health people call the social determinants of health. So when we look at the social determinants of health, let me backtrack. I'm gonna go back just a little bit for you to kind of lay this out and make it make sense. So your health is made up of about 5 different areas. Usually, when we talk about health, we're talking about our health behaviors. Like, do you take care of yourself? Do you take vitamins? Do you drink water? Do you exercise? What do you eat? How do you eat? How much do you eat? Are you overweight? All of that stuff that we talk about. Do you take your medication every day? All of that, all those things that you do for your health, those are called health behaviors. Health behaviors make up about 30% of your overall health. Now you might be thinking, "What, girl? I don't eat, then I'm dead." However, while that is true, when we look at what makes you healthy, what your health is made up of, these other pieces of your health, which would be determinants of health, your socio and economic background and current place in life, whether or not you have access to health and healthcare services, and your physical environment. Those 4 pieces, your personal health behavior, and those other three are called the social determinants of health. These are factors that can influence your health and they influence your health behaviors. So these socio and economic factors, access to healthcare and medication, to doctors, your physical environment, all of those pieces, right, make up 70% of your health. Why is that a thing? And so if we look at your health behaviors, do you eat well? Do you eat lots of fruits and vegetables? Do you drink lots of water? Are you getting your exercise? Those are like the big questions that the doctors ask you. What you eat relates to what you can afford to purchase. What you can afford to purchase relates to how much money you have to buy food. So it's not just do you eat your fruits and vegetables, but do you have access to those fruits and vegetables? Access both in proximity, like can you get to the grocery store, and access in economics. Do you have the money that you need in order to buy the produce and the vegetables and make healthier purchases once you get to the store? Does that make sense? Another area when we look at these three with these the three that I talked about, the social determinants of health are further broken out into like 6 groups. So I gave you 3 overarching, but if we just put them all in one category, social determinants of health, that 75% is broken out into economic stability. We talked about that a little bit, right? With access to produce and vegetables and making healthy choices around food. So you have economic stability, neighborhood, and built environment. Built environment is literally what's been built around you. The homes, parks, community centers, schools, air quality, right? Sidewalks, walkability, having grocery stores in your community, that's your built environment. Access to the healthcare system. So, not just do you have them in your area, but are there doctors that are there? Are they staffed? Are the healthcare facilities staffed? Are they staffed with trusted and qualified providers? What is the quality of care like? Is it readily available? Is the care culturally and linguistically competent? Right? Like it's more than just there's a doctor's office or there's a hospital. Language access is another area. So being able to understand the words that the doctors and techs and medical folks are using. Health literacy, digital literacy, and access to technology falls under language access. This is all, and also financial literacy, all gonna mix and gonna bring it back together. Social and community context is another area. So your social supports. Do you have community? There is a saying, it takes a village to raise a child. Like, where is the village? Do you have the village? And is the village villaging? Community development, discrimination, racism, inequity, stigma, even incarceration. These pieces all fall under social and community context. And the last of these 6 determinant areas, social determinants of health, are education, early childhood education, access to higher education, high school education. Is it a good quality education? Do you have access to trade programs, vocational and educational trainings? All of that, formal education, being able to utilize your life experience, all of that falls under education. So, all of those things that I just named are considered the social determinants of health. That makes up 70% of your health. So you've got your health behaviors, and we talked about what those are, right? Are you eating well? Um, are you getting your exercise? Are you taking your medication? Are you taking your vitamins? Are you keeping your stress levels low? Are you going to the doctor? Are you keeping your appointments? Those are all health behaviors, the things that you actually do. You are in full control of them, but when it comes to your health, it's a small piece of your overall health. The rest of that makeup is the social determinant of health. And those 6 areas, again, are going to be education, social and community context, language and language access as it relates to health literacy, digital literacy, in understanding the language that's spoken to you, healthcare system, so access to the actual doctors and hospital systems, quality of care, neighborhood and built environment, and economic stability, jobs, poverty, employment, like food security, transportation, credit debt, all of those things, that all falls under economic stability. So this big arch, this big umbrella of determinants of health, I'm going to soften that language a little bit and call them drivers of health, because you can do all of the right things and also have the best social determinants of health, and you can be very healthy or you could still be very sick, because we're all individuals. So what I'm talking about is, as a community, as we are together in this human race in space, these are the ways in which we can be healthier folks. Or these are the ways in which we define and can kind of quantify our health. So when it comes to Black and Brown folks in Monroe and Erie counties, what we find is, and generally across the United States, this is true, but what we have noticed when looking at health outcomes is that if you live in certain areas of a place, if you live in a certain type of home, if you live within certain zip codes or certain geographic areas, if you go to certain schools, you are more likely to have poor health outcomes. Black folks in New York State are 300% more likely to be hospitalized from complications of diabetes than their white counterparts. I'm going to say that again. Black folks in New York State are 300% more likely to be hospitalized from complications of diabetes than their white counterparts. I want to let that sink in for a minute. That is not because all of the Black folks sought out diabetes and sought out to eat poorly. When you look at the conditions in which folks live, when you look at the social determinants of health, not just built environment like the home, not just economics, right? But all of the pieces, a picture begins to kind of become clear about how people are living and what they have access to, and how those things relate to their health outcomes. So, if you grow up in a community where there is old housing, our area has a very old housing stock. So, there is a lot of poor quality housing. Add that to jobs that do not pay livable wages, that do not offer healthcare benefits, or offer healthcare benefits that do not meet the needs of the community. If you look at the transportation system and folks' inability to be able to just hop on a bus and go somewhere and get to a location, and it doesn't take them 3 hours, right? If you look at social and community context, like, is someone that has a past relationship with the criminal justice system likely to have better access to jobs? No. Is someone who goes to a underfunded or a poor performing school likely to get the type of education that they need in order to be able to go to a school of higher education? Or will they be equipped with the skills that they need in order to enter the trades? Is that likely? No. Are those folks then likely to go on and get jobs or create businesses where they're bringing in enough revenue to be able to afford a lifestyle that supports them being healthier? Not likely. So when you add all these pieces together, it paints a story. So what does that have to do with your health? Can you begin to see how, if you look at these social determinants of health, how you may not be able to make the best health decisions, or you make the best health decisions with what you have? Can you begin to see how, when something like a worldwide pandemic occurs, that people with the lower paying jobs, people with labor intensive jobs, people with frontline, quote unquote, jobs like people working in grocery stores, people working in labor-intensive positions, people working in the transportation industry. They can't work from home. They can't afford to take time off. They still have to show up. So they can't take care of their health and prioritize their health the way others can. Can you begin to see how poor health outcomes occur? And you may say, oh, well, just go to the doctors. How does one get to the primary care doc if you have one and it didn't take you 3 months to get your appointment? How do you get there when you have to take off from work? You may or may not have transportation. So if you have to rely upon public transportation, wow, how do you get on those buses and or trains? How do you get the kids from school and take off from work and get them to the doctors and then get them back to school and get back to work? How do you do that? I don't want to paint a picture of hopelessness because that's not the case. I just want you to be able to see how you may not be able to have the same opportunity to be healthy as someone with a different set of determinants of health. And what we find when we look at population data, when we look at communities, when we look at cities and towns and counties and states, country, is that here in our area, Black folks and most brown folks have poor health outcomes because of all of those things that I just named. And so, yes, we can make the best decisions that we can, and that's what we're going to do, right? We can plan to be healthier, and we're going to talk about that. We can take control of our health, and we're going to talk about that. We can come up with a healthcare plan. We're going to talk about that. We can educate our family and friends on what it means to be healthy, and we're going to talk about that. We can become health champions for ourselves, for our friends, and for our family, for our community. And we're going to talk about that. We're going to talk about that in the next episode of the Healthy Illness Podcast. So, your biggest takeaways for right now: what is health? What is health? And what are some risk factors of disease? So, we talked about health. We talked about the components of health. And so, when we look at the risk factors, what are risk factors? Well, the risk factors would be, if we go back to the social determinants of health or the drivers of health, risk factors would be not having the opportunities and having the structures set up to have a good education, to have strong social community supports, to not having language access, not having access to the healthcare system, to not having a safe built environment and safe neighborhood, and to not having economic stability. Like, those are your risk factors. So the more folks that fall into that category, the more likely you are as a group of people to have poor health outcomes. So next, what we're going to do, if you choose to come back and listen to the next episode of Healthy Illness Podcast, we are going to talk about how you can go about making decisions around your health, around your wellness, around your support systems, around your planning, around advocacy in healthcare, so that you can be your healthiest you. And so that you can encourage those that you care about to also be their healthiest thems. And that we as a community can be healthier mentally and physically together. Until the next time, be the way.